Hello, my name is Dr.Fraum, and I'm an assistant professor of radiology with appointments in abdominal imaging and nuclear medicine at the Washington University School of Medicine in St. Louis, Missouri. I specialize in oncologic imaging with a focus on MRI and PET studies. RECIST, spelled R-E-C-I-S-T, is an acronym that stands for Response Evaluation Criteria in Solid Tumors. RECIST is a system used by radiologists when interpreting imaging studies performed to determine how well a tumor or set of tumors has responded to therapy. The word solid in the name of this system indicates that it is only appropriate to use this system for certain types of tumors. Many types of tumors, such as lung cancers or liver metastases from colorectal cancer, are considered solid tumors. In contrast, hematologic malignancies, which arise from blood cells or the bone marrow, are considered liquid tumors. Examples would include leukemia or lymphoma. The RECIST criteria would not be appropriate to use for these types of malignancies. Other types of tumors have specialized systems to assess treatment response that were developed to address their unique imaging features. For example, for a type of liver cancer called hepatocellular carcinoma, a system called mRECIST or modified RECIST has been developed. Similarly, for lymphomas, which are often imaged with PET scans, we use a system called the 5-point scale to determine how metabolically active the cancer is. So, to summarize, depending on the type of cancer you have, the RECIST criteria may or may not apply. The RECIST criteria were developed by an international group of oncology organizations and first released in the year 2000 with a subsequent update in 2009. The RECIST criteria have been validated by multiple additional studies, which have shown that RECIST classifications of disease status on imaging correlate well with how patients do in terms of remaining cancer-free or in terms of years of life lived after diagnosis. The purpose of the RECIST criteria is to standardize the way radiologists reading CT and MRI examinations measure tumors and assess the overall burden of malignancy in cancer patients. This is especially important for clinical trials testing new cancer therapies, because determining whether a treatment is effective requires having a reliable way to measure the initial disease extent and to identify changes in that extent over time. Today, most clinical trials for patients with solid tumors that include imaging in the study protocol will utilize the RECIST criteria. Some radiology groups also use the system outside of the clinical trial setting to assess cancer treatment response in patients on more established treatment regimens. However, in many radiology practices, cancer treatment responses are assessed in a less formalized manner based on the radiologist's overall sense of the disease burden. When using the RECIST criteria, a radiologist will compare their most recent imaging study, usually a CT or an MRI, to a baseline study. The baseline study is typically the imaging study that was done at the time of initial cancer diagnosis or immediately before the last time your treatment regimen was changed. The radiologist will then measure the maximum size of your tumor. If you have more than one tumor, the radiologist will measure the maximum size of a certain set of tumors and then add up those sizes. The size of the tumor, or total size of multiple tumors, is then compared to the size on your baseline study. The change in size from the baseline study is then calculated as a percentage. For example, let's say you have two tumors that measured 6 centimeters and 4 centimeters in maximum size on CT at the time of your initial diagnosis. The total size of the tumors would be 10 centimeters for your baseline CT scan. Now, let's say that you've been on chemotherapy for several months and have another CT to see how well that treatment is working. On that second CT scan, your tumors now measure 2 centimeters and 1 centimeter in maximum size for a total size of 3 centimeters. No new tumors are seen as well. The change in total size from 10 centimeters to 3 centimeters equates to a 70% decrease. According to RECIST criteria, this would be defined as a partial response, as the tumors did not entirely resolve, but the total size of all tumors measured decreased by at least 30%. RECIST has similar definitions for a complete response, meaning that your tumors have entirely resolved, stable disease, meaning that your tumors haven't significantly changed, and progressive disease, meaning that your tumors are getting worse or that new tumors have developed. So you can see how RECIST allows different radiologists to speak a common language and use terms that have very specific meanings when communicating what they see on your imaging study to your doctor. That is the value of the RECIST criteria in cancer care.